All right, I'm going to go ahead and get started. Good afternoon, you all. My name is Carla D'Imperio, and I am the Director of Family Support with the Phelan-McDermid Syndrome Foundation. I'm really excited to be with you all for, let's see here. I think this is our eighth Pathways Education Series webinar of 2025. So we've been presenting monthly webinars on various topics chosen by you all, by our community, and this month's topic is a big one. It's promoting overall health in Phelan-McDermid syndrome. I sent out a survey at the beginning of the summer. We took a little summer break. So before that break, I sent a survey out to our community, and it was one of the topics that was chosen. And it's a big one. So I think we had a lot of interest, and hopefully you'll be able to take away some concrete tips and strategies from today's presentation. Um, and let's see here. I'm gonna share my screen, and I'm gonna go ahead and get started. So, like I mentioned, our topic is promoting overall health in Phelan-McDermid syndrome. I'm Carla D'Imperio. I am the Director of Family Support and mom to Matthew, who's my 10-year-old son who has Phelan-McDermid syndrome. And I am happy to be in the role supporting our families. Please keep in mind that this presentation is not medical advice. Recommendations made in this presentation do not represent the opinion of the presenter or of PMSF. Please discuss any medical decisions or changes to your loved one's medical treatment with his or her medical professionals. And also keep in mind the presentation focuses on physical health, but not to discount mental and social health are very important components of overall health as well, but they're just not covered today during this presentation. All right, so let's go ahead and get started. I think before we get into, oh, I see you guys in the chat. Perfect. Thank you. Helpful to know you're all out there. Um, when we're talking about how we're managing care for our loved one who has Phelan-McDermid syndrome, there are some overall guiding principles just to keep in mind throughout the presentation. One is trusting your gut. As parents, you are the expert in terms of your child and their health and their needs. You know them best. So if something feels off to you, if you feel like the um, medical care that you're getting, there's more to it, or you're not quite sure, trust that feeling and dig into that and look for second opinions, um, and look for other ideas. Educate yourself. Clearly, that's something that this group is already interested in because you're here today. You're spending time in the middle of a day learning more about Phelan-McDermid syndrome. So keep doing that. The knowledge is power with this diagnosis, and the more you know, the more you're going to be empowered to be able to keep your loved one healthy throughout their lifespan. Balance trust. So trusting, medical um, the medical professionals, balance that with some level of skepticism. So asking questions, being curious, digging deeper. It ties in a little bit to that listen to your gut piece, but obviously you know your child best, and the medical professionals who've been treating your child or adult know them as well. So you want to make sure to be asking those questions and staying curious when you're making decisions about their care. Seek support and help. That again, this group probably is already doing that because you're here today, but there's lots of ways to seek support in the care for your child, whether it be bringing someone along to doctor's appointments to help actually watch them so that you can really engage with the medical professional and talk to them. Whether it be reaching out to PMSF if you're in crisis and having a hard time to see if there's any ways that we can help you all. And the last one to keep in mind is building enduring partnerships. So a lot of times, if your child's going through a difficult spell medically, um, if you're frustrated, you might want to speak, you'll say, oh, I want to talk to whoever is in charge or the attending physician at the ER, for example. Well, approaching those relationships with respect and humility and trying to build a partnership is probably going to get you further in the long run because that same doctor might be there the next time you go into the emergency room. So keeping in mind that some of those relationships will be long-term, and can be partnerships that can help your child or adult over a longer period of time. The same holds true with the school system, for example. If whoever's in charge of the IEP meetings, it might be the same person year after year. So figuring out how to work together can be a helpful strategy to help move things forward. All right, so we're going to kind of break this down into two pieces of overall health. two sort of ways of looking at it. One piece is staying healthy and preventing issues. Not everything can be prevented, but there is a lot of really great information out there available that can help you keep your loved one healthy and hopefully help prevent issues from arising. And then later in the presentation, it will be more about what to happen when things don't go as planned and when those types of problems and issues can come up, how to handle them. Um, Again, keeping in mind that things will go awry at times. There are going to be times where things don't go as planned, and not everything can be prevented. So there are some components to staying healthy that we're going to talk through: routine medical and dental care, nutrition, exercise, sleep, vaccines, and then some smaller components like hydration and hygiene. All right. So when you're talking about overall health for an individual with Phelan-McDermid syndrome, one of the really important ways to be able to keep them healthy and keep them followed by the right team is to establish that coordinated care team. And that's really going to begin. I grabbed this graphic from one of our clinical consensus guidelines around this topic, which I'll show you where those are. But it's really going to begin with your child as the center of that whole the piece of the puzzle, right? And then from there, it's going to kind of go out in bands and expand. But the first person involved in their care, besides you and your child, is going to be that primary healthcare provider. So the PCP, that person is the one sort of intimately involved in the care of your child. So you're really going to want to establish with someone who's going to be able to oversee their care, who's willing to talk to other medical professionals, who's willing to learn about Phelan-McDermid syndrome, and sort of serve as that coordinating physician who's going to connect through these different layers of care for Phelan-McDermid syndrome. Outside of that primary care provider, then you're going to be talking about, this calls it a regional care team, but it's really, it doesn't even have to be regional anymore because we do have access to virtual care. But that's going to be more that multidisciplinary team of different specialists who are going to be helping your child with things like neurology and genetics and GI and all of those other pieces of the puzzle. Again, those specialists ideally would be in touch with that primary care provider, and there would be communication kind of facilitated um, through this coordinated care concept where they would be talking to each other. Maybe they'd be able to communicate through something like my chart, and they would be able to kind of stay on the same page about your child's care and treatment. So this type of team is kind of the first step and the basis for promoting your child's overall health, to have them set up with this multidisciplinary team who's connected and willing to learn and talking to one another. And then this concept of Phelan-McDermid centers of expertise, which this graphic comes from our European guidelines, and so that is kind of a term that they use, and they do have some centers like that in Europe. And right now, what we have in the United States are some doctors that do see patients with Phelan-McDermid syndrome, and they would be the ones that could help provide that sort of expertise regarding the syndrome and be able to talk to the regional care team and talk with the primary care provider and provide that level of expertise. So the people facilitating all of this communication would be, again, that coordinating physician, which usually would be the primary care, maybe not always, and then the caregiver, which is probably you. So let me see here. I want to show you where I got this graphic from because I think it's important for you all to have access to these, the whole paper about this, and hopefully you can see the screen, my screen, but I will be sending you all this link. So this is the clinical consensus guideline, our European guidelines about the coordination of care in Phelan-McDermid syndrome. And if you go through and read it, it's a very detailed scientific paper, but there's a lot of really great information in here for caregivers. So what I want to make sure you see, and we can't get into too much depth with it right now, but it's this chart that sort of shows the different disciplines. So here's genetics. It's pretty small. genetics, mental health, communication, speech and language, sleep, eye and vision. And then it tells you sort of the guidelines around at what age you would want to be doing different evaluations and different visits to those professionals based on the different topics. So, for example, for a referral, let's see, psychiatric and behavioral status, you would get a baseline measurement at diagnosis, monitor changes from 0 to 2 years, monitor changes in skill level, et cetera. And it kind of gives you that play by play. So this is a really helpful document as you're thinking about coordination of care across different disciplines and different specialists. Let's see. Okay, so the okay, the coordinated care team concept that we were just talking about. So again, through these different layers, that primary healthcare provider, also here referring to the coordinating physician, that main person who's going to be overseeing your child's care. Um, I like to call them your care quarterback. And this is a concept that we talked about in one of our earlier pathway session. And I just wanted to refresh you with this slide. So if you feel like you've seen this already, you maybe have. So this person doesn't have to be the primary care provider, but a lot of times it is. They should be a great listener, willing to learn and talk to other professionals, able to connect and communicate with other professionals, willing to use our resources and learn. Pretty easy to get in touch with. You can get in with them quickly if you need to. Connected to a hospital. So, if your child is admitted, they would be able to be privy to their situation and what's going on. It doesn't need to be an expert in Phelan-McDermid syndrome. So using this kind of graphic, it's great if you have that expert in there. If there's someone with expertise in Phelan-McDermid syndrome involved in your child care, that is kind of the ideal, but it does not have to be that primary care person or the person that's coordinating the care. Sort of flags for a doctor would be things like looking on Wikipedia and Google while they're talking to you. So if they're trying to get their information that way, in the moment, that's not great. Dismissing your concerns or not acknowledging your child, not engaging with your child, and I mean adult child as well. So those are sort of some flags you might want to keep in mind. Okay, and then in terms of the clinics, so this question was put out about the UK. I don't have a list of clinics internationally on our, PMSF does not have that on our website right now. But what I will do is get that information and send it out to you in my follow-up email. I will show you though, in the United States, PMSF has identified these clinics currently shown on this map. And if you go to, it's pmsf.org/PMS clinics, and scroll down, then you're going to see how you would be able to get in touch with those medical professionals. Now, this doesn't mean everybody would be able to get an appointment. It means you would have to call and they would say, look at the insurance that they take and whether it's pediatrics or adult or both. But these are doctors that are currently accepting new patients with Phelan-McDermid syndrome and see patients with Phelan-McDermid syndrome already. So they do have some level of knowledge or in some cases expertise in the diagnosis. So when we're looking at that, circular model, they would be the ones kind of in this outer circle as the people with the expertise in the diagnosis. So in addition to this care team that we talked about, including these sort of layers, so we talked about these layers, there's going to be others in the care team as well, which I have another little graphic here showing all these other different people involved in the care of your child. So these would be the layers of multidisciplinary specialists, GI and cardiology. Down here we have school. And right here is the one that I have the different therapies. So therapies can be a really important part of keeping your child healthy, or your adult child healthy. And so I have a list here of some of the kinds of therapies our families use. So I would take a moment and just look at this list. There's probably therapies named here that you've never heard of. Um, but some of these different types of therapies are, all of them are very beneficial for individuals in our population. I wouldn't say you would do all of these types of therapies at once, but I think it just gives you an idea of what's out there. And if you see something that you're like, oh, I've never heard of that, talk to your child's medical professionals about it. And maybe it's something that they could benefit from. My son did hippotherapy for many years. It was therapy on horseback. He would do PT and OT and speech while on horseback. And for many years, it was excellent for him. He would, when he got off the horse, he was just more grounded and centered, and he would be able to just do more in terms of skills. He was better on his talker. He was just more kind of grounded and engaged with the world. It really did help him. And then there was a point where we decided it was time to take a break because we weren't seeing the same level of gains that we'd seen for a while. Another one that he's done that's not, your kind of run-of-the-mill therapy is therapy intensive. So we went through Napa therapy intensives, which I know they do have a location in the UK. They have several locations around the United States, but they do the intensive therapy model where you're doing like a 3 week period of having several hours a day of therapy, whether it be PT, OT, speech. And they also use a TheraSuit method, which is like a full body suit with different types of sensory input. So that was amazing for him. He made great strides with his communication device during that time. And they also taught him to get into and out of the bathtub, which he still does now over a year and a half later. So they asked me, what skill do you want him to learn during the OT sessions? And in 3 weeks of OT every day, they taught him how to get in and out of the bathtub. So pretty cool. And that is a life-changing skill that can help him in terms of staying healthy, right? That he can get in and out of the bathtub safely without falling. It makes him kind of part of his own caretaking in a way that he was not before we were lifting him in and out. And it makes things easier on the person caring for him. Okay, and then let's see. So take a look, some of these you've probably heard of, maybe you've heard of all of them. But chances are there's some therapies out there that you haven't tried, or maybe it's been a while since your child's been in physical therapy or something, and it's time to think about, is that something they should be getting back into? Do they need strengthening? Do they need, to build some skills that would actually really help them in terms of their day-to-day health? Okay, and I'm going to send these slides in my follow-up email as well, so don't feel like you have to write everything down if you see something that you're interested in. Nutrition and supplements is a big topic, and obviously that's a big part of staying healthy is what you're putting into your body. And we are offering an entire session about this in November. So our next pathway session will be with Chardell Buchanan, who is a licensed dietitian nutritionist and also a Phelan-McDermid syndrome mom, and she will be facilitating this session. So if you are interested in coming, that's the link to register, and I'm going to put I have a slide at the end with the time and date and everything in there. So table the nutrition, but it's coming. This is a big one. So exercise, I think for those of us that are adults, when you go to the doctor yourself, they probably talk about exercise and ask you, how many times a week are you exercising? It's the same thing for our children. And I think for our kids, it can be really hard to get in that exercise. I know my son, he wants to lay around and watch his tablet. That's what he wants to do. So we really have to be diligent about getting him up and getting him moving. And I don't think that gets easier as the person gets older necessarily. So when I talked to our medical advisory committee about this session, just to get, did they have any ideas? Did they have any tips? This was one of the ideas, the concrete things that they told me about was the concept of prescribing exercise. So the recommendation that they gave was at least 45 minutes per day, 5 days a week, even if it's just walking. Um, for Matthew, that's a lot. That's hard to get him walking for 45 minutes a day straight. That would take some effort. So I think this is a great kind of concrete tip you can walk away with today is, okay, that's something we can try to do, is to get in that exercise. And if your child or adult child is living in a group home or a residential facility, you can actually get the doctors to prescribe the exercise. So then the facility would have to put that prescription into place. So they can write an order for exercise, and then your child would have to get that exercise daily. So that's a good thing to keep in mind as well. Um, for my son, swimming and his adaptive trike are other really good options for exercise. It can be hard, my 13-year-old, well, he can find tons of ways to exercise without even really, thinking about it, but it's a little bit harder for our children with Phelan-McDermid syndrome. Okay, and sleep is another one, right? So we all know that part of staying healthy is getting a good night's sleep. Well, that's easy to say and a lot harder to do when you're talking about someone with Phelan-McDermid syndrome. So I wanted to make sure that you all are aware of a couple of resources that we have around sleep. So I'm going to pull them up on the website. Um, a lot of our wonderful resources from PMSF are on this page on our website, which I will share with you. It's medical issues and clinical care. If you scroll down, so all of our medical advisories are here. Um, and if you keep scrolling, you're going to get all of our clinical consensus guidelines. There's an entire European guideline on the topic we already talked about, which was organization of care. So that was what I already shared with you with that blue circular graphic. And then there's also one on sleeping problems. So there's a whole European guideline written only about sleeping problems and Phelan-McDermid syndrome. So I'm going to open that up real quick and just show you what it looks like and what the recommendations look like. And then I'm going to walk us through the pharmacological recommendations that we have. Okay, so all of these guideline documents are very sciencey, very tiny font. They come from studies, they're pulling studies together and then making sense of them and giving recommendations. What I like to look at with families is the recommendations table. So each of these has a recommendations table that kind of distills everything down into very concrete recommendations. That is not it. It will be on the next page. Here we go. So you can see table 3 says recommendations agreed upon by the European Phelan-McDermid Syndrome Consortium. So every individual with PMS and sleep problems should be evaluated for somatic and/or environmental and/or neuropsychiatric causes. Um, for us, we see a sleep neurologist. That's the type of specialist that my son sees for sleep. So, if your child is having those kind of classic Phelan-McDermid syndrome sleep disturbances, then you would want to seek out a specialist who could support sleep and could help you figure out how to get your child to sleep the best that they can. Again, sleep is really important for our health. It's important for brain development, um, and it's just an important component. So getting your child to get as much sleep as possible is really important, and there are ways to support that. So again, that sleep specialist would be starting by evaluating those types of things. That might mean having a sleep study. It might mean doing some sleep journaling and keeping track of things. Um, Mental health conditions co-occurring with sleep problems should be investigated and treated. In individuals with PMS with sleep problems, sleep hygiene should be evaluated and caregivers should be supported in establishing a structured approach. So this would be sleep hygiene would be, is there a good routine, like a bedtime routine? Are the lights turned off? Is the room dark? Is there a sound machine? Um, is the bed, comfortable and set up appropriately? Is the temperature in the room appropriate? Those types of things would be considered before they would start talking about medical pharmacological support for sleep. And then if sleep problems persist despite appropriate interventions, then they should be referred to an experienced specialist experienced in sleep problems or a specialist sleep center. So that this is basically saying, look at all of those things and then you would go forward with getting that sleep specialist. And at that time would be when things like medication for sleep would be considered. Sorry, I'm hopping from tab to tab. I want to show you where about those medications though. And again, I will send you the link. All of our recommendations for pharmacological management of symptoms in Phelan-McDermid syndrome are here. And these are related to behaviors and psychiatric symptoms. Okay, so every page in this document talks about a different topic. So the first page is attention deficit, hyperactivity, and impulsivity, but I'm going to scroll down just quickly and show you that the last page has to do with sleep, which is what we're talking about. So this top bit basically talks about what the guidelines just referred to, which is things like sleep hygiene, ruling out physical causes like restless leg, ruling out neuropsychiatric causes. And if all of that is ruled out and your child or adult is still having sleep disorder or sleep disturbance, then you would proceed down here with the doctor. The prescribing doctor would be the one making the recommendations, but using this as a tool to help, um, to start with medication to support sleep. And it shows the starting point as melatonin, and 5-HTP. And then if there's no response, that's when you would move on to the next, which would be clonidine or trazodone, etc. So this document would be used as a guide with this sleep specialist to help support your child in getting better sleep and gives them next steps. If one medication doesn't work, then there's a next step to try something else. Okay, but they're not going to want to start going through this piece until you've ruled out all of these parts, um, which is what those guidelines say as well, to rule out some of those other causes and make sure there's good sleep hygiene happening. Again, I know easier said than done with our kids. Sleep can be so challenging. We just got my son a safety sleeper bed. I would say that's been a huge, huge success for him so far. We've had it for about 3 weeks now, and it's made a tremendous difference in his sleep because I think he feels very safe in there. And if he wakes in the night and tries to get out of bed, he can't, and he's not getting upset about it. He just is rolling over and going back to sleep. So that type of thing too can be a game changer in terms of managing sleep. All right. So that's a little bit about sleep, and I don't want to minimize it or simplify it because I know it can be so hard. We live it in my house with sleep, but we do have those different recommendations and the pharmacologic guidelines to help support you as you work with your child's doctor, to try to solve the problems around sleep. All right. Our medical advisory committee just issued a new advisory about vaccines. And so vaccines are definitely one way to prevent illness and to maintain health. So I wanted to just share, I'm not sure that we've even posted it on the website yet. So it's a brand new advisory. You all are kind of the first to hear about it. But the gist of it is in bold. So the Medical Advisory Committee advises that families and their medical providers follow the American Academy of Pediatrics recommended child and adolescent immunization schedule. This includes immunizations for children under 18 years of age, and then it gives some examples. And then in alignment with the Centers for Disease Control and Prevention, the World Health Organization, and other leading health authorities, we strongly recommend that eligible adults with PMS, that should say PMS, so we will change that, with PMS, remain up to date with routine immunizations, including flu, COVID-19, shingles, pneumococcal, and Tdap. And of course, we encourage you to consult with your child's healthcare providers as you make decisions around immunizations and bring any concerns you have to those medical professionals. So this is definitely part of prevention, is keeping your child or adult up to date on their immunizations. I know for Matthew, he is, everything's in his mouth. He'll lay on the floor in public places. He's always chewing on things. He'll put his hands in the sink in a public bathroom. He doesn't care or understand anything around how germs spread. So for him, it is really important that he's as protected as possible from different types of diseases. And then other components of physical health, I just want to make sure to touch on. We could probably have a session on each and every one of these slides, and get very deep on them. Dental care is huge, and it can be really hard to find a good dentist who will listen and be patient and gentle with your child. So one of the things to think about, if we'll get to this a little bit later too, but if your child is having um, unresolved symptoms and you're not sure what's going on, and for us, Matthew is nonverbal, so it can be very hard. One thing to consider really is if there's a tooth problem, if there's a toothache, if something's happening that you can't see, because that can cause behavioral issues and can cause a lot of pain. We are really we do work very hard to brush his teeth and keep his dental hygiene up to date. He sees the dentist every 6 months, and it can be hard, to brush his teeth thoroughly because he doesn't participate in it, and a lot of times he just chews on the toothbrush while we're trying to brush. I know now there are some different kinds of toothbrush options that can make it easier, electric toothbrushes, and there's one that you can sort of put in their mouth and they bite down and it brushes everything at once. So you can look into different things like that and talk to your child's dentist about options to make it easier. Um, in terms of hydration, that's obvious. We all need to be drinking water. But for our kids, a lot of times they're not going to ask for water, and keeping them hydrated is just so important for their overall health, for the health of their kidneys, and all of that. So just a reminder that that is definitely a piece of it that can be overlooked. And when my son has like a cyclic vomiting episode, we're always trying to just keep him hydrated and keep him from having to go into the ER for fluids. I mean, that's really why he ends up having to go, is because he's starting to show symptoms of dehydration. Chloe's asking, how well does he tolerate the dentist? So we're really fortunate with our dentist. My children have seen the same dentist since they started getting teeth. And for the first couple of years of care, all the dentist did was give them praise and stickers and rewards and just kind of quickly look in their mouth. Um, Honestly, and I was always like, are you sure? Did you get a good look in there? But they really were trying to build that positive experience. And I don't think they really even put them in the chair at the dentist until they were more like 4 years old. So he does well, um, considering that he does not like it. They're very patient with him. They only do as much as they have to. And then when there are times where he needs sedation, then we do a lot of things at once. So he does have a sedated dental procedure coming up. One thing that we really like about our dentist is that they will do the sedation in office, and they have it's like a mobile OR that does sedation, IV sedation, I think once a month. They have a full day that they book sedated procedures. So when he has that, he has to have two baby molars pulled. So it won't take long. And for other children, it would not be a sedated procedure. Um, but when he does have that done, we're going to do the full panoramic x-rays. We're going to do um, impressions for a night mouth guard, which may or may not be a success for him with his teeth grinding, but I think it's good to try, even though he might just throw it across the room. But we're going to try to do all of that at once while he's under sedation. And then when he goes for his regular visits, just try and get in and do as much as he'll tolerate and still not be afraid of going. Um, right now, he does do okay. Like I said, he's 10 years old, so it does get harder, every year as he gets bigger. Um, we travel too. If you're in the area I live in, we're like 40 minutes from Tampa, but we go to downtown Tampa because that's where the dentist that we love and that has been with our kids. They moved and that's where they are, and it's worth it for us to have that drive, often in traffic. So, um, that's dental care, hydration. Okay. Hygiene is another one and seems very simple and straightforward, but I think hand washing, is a really important way to prevent sickness and germs. And our children, my Matthew does not wash, he cannot wash his own hands yet. He doesn't understand about germs. So we're constantly, soaping him up, washing him, and trying to make it fun, trying to make it something that he enjoys. But it's up to the adults and the people caring for him to try to keep his hands clean. It's hard. Definitely not an easy task. Um, but I think the dental care and the hygiene also tie in because that oral hygiene is really so important. Okay, I see something in the chat. Any tips on recommending for hydrating my child? She used to drink juice and water with no problem, and all of a sudden she starts refusing it. So, that makes me wonder if it's all of a sudden that she's refusing it. I'm wondering if she has pain or if something's changed with um, something that you're not aware of. Is there something bothering her in her mouth? How long has it been that she's been refusing it? Have you tried different cups and adding things like, you can add flavors to water, like the Crystal Light packets or liquid IVs and things like that? Have you tried anything like that to make it taste different? But if it's a sudden change, a sudden behavioral change, it kind of makes me wonder if there's more to it. Um, okay, we don't have time to get into all of these resources, but I did pull a few of them. So you all know that we do have our medical advisories. We do have European consensus recommendations that I showed you. We also have another version of the consensus recommendations made by US and international doctors. And then I did show you the pharmacologic recommendations. So I will send links to all of this, and using those guidelines really does help support um, your child's health because you can read about different issues they may have in different body systems. You can share them with your child's medical team, and it can really help with preventing some things from happening. Okay. Being prepared for the unexpected is kind of the second piece, right? So we talked about prevention. Not everything can be prevented. We can try the best we can and do as much as we can to mitigate your child getting sick more frequently and to make sure they get good care. Hydrate. But ultimately, we also do have to be prepared for unexpected issues that can arise as a result of this diagnosis, which can include things like complications of severe epilepsy, choking and aspiration, and GI problems, so problems with digestive tract functioning. So these are some of the more severe issues that can come up with Phelan-McDermid syndrome. So I want to talk a little bit about each of them and just some tips and things that can be helpful for caregivers. It's a lot of text on this slide. So for complications of severe epilepsy, we have a whole consensus guideline, the European consensus guidelines around epilepsy, which is what I pulled from to make this slide. We also have a whole section of our US international guidelines about epilepsy. So those are two resources that I will send out to you all that you can share with your child's neurologist, whether they're having seizures or not, and whether if they are having seizures, whether or not they're managed. The guidelines are still really helpful to have. Regular EEG monitoring is recommended in Phelan-McDermid syndrome, so you can have an idea if there's any unusual brain activity happening. That's the way to see that. If your child is having seizures, working closely with the neurologist to find if your child is having seizures and medication has been recommended, then finding the most effective anti-seizure medications while minimizing the side effects. So unlike some other symptoms, like our psychiatric symptoms, for example, unlike that, Phelan-McDermid syndrome does not have a special guidance for treating epilepsy. There's not a special medication or to use or not use. It really is treating according to standard practice or according to national guidelines. So the process for that will really be working with the neurologist and trying to find the right seizure medication and the right dose to manage the seizures. In terms of severe epilepsy and complications that can happen, the best way to prevent those things from happening is by managing the seizures, right? So that's why getting that seizure medication correct is so important. You would want to track triggers and integrate those triggers integrate that with the management of the seizures, both through sleep and behavioral health care, and then taking steps to keep your loved ones safe if they are having seizures or even if their seizures are currently being managed. Um, Monitoring them at night, so using a video monitor, or some of our kids have their pulse ox monitored at night. Um, Sometimes you have alarms for those different types of monitors. If the pulse ox reaches a certain point, the alarm goes off. Um, a soft shell helmet can be something for individuals that have drop seizures, for example, if there's a risk of injuring their head. A soft shell helmet is an inexpensive and easy way to mitigate that risk if the individual will tolerate the helmet. My son wore a helmet for several years. I think maybe 6 or 7 years of his life, he's worn a helmet. And once he got used to it, he put up with it fine. He wanted it. I think there was a point where he actually understood that it helped him and helped to keep him safe. Um, water safety and seizures, that's an important thing. So especially living in Florida, there's water everywhere. Everyone has pools. So you just want to be familiar with water safety and how that relates to seizures and keeping the person safe. Um, And then for uncontrolled seizures, you want to discuss other options with your loved one's doctor. So things like surgery, neurostimulation devices, different dietary therapies. Those are all things you could bring up with your child's neurologist and talk about. Is there a point where those would want to be considered? What are the risks? What are the benefits? And help make decisions around those topics. The Epilepsy Foundation and REN, which is the Rare Epilepsy Network, they both have excellent resources for managing seizures, for SUDEP, for all of these different topics. So I'm going to share those links with you in my follow-up email. So if your child is having uncontrolled seizures, or if their seizures are managed, either way, you can get some good resources from those organizations as well. Let me see what's in the Q&A right now. So how do you recommend monitoring at night just with a baby monitor? I mean, I think this does depend on the person. So if you have a child who is having, frequent seizures, and you have an adult who's able to, it can be beneficial to have someone sleeping in there with that person. We were sleeping in with my son and up until recently when we were able to get him the safety sleeper bed, and he wasn't having seizures, but it was for his safety to try to keep him from wandering around the house and having these night wakings where he'd wake up and feel worried and get out of bed. So I think it can really depend. It could be that, it could be having someone in there with them, it could be having the pulse oximeter monitoring the person. It could be having the video monitoring. They do make seizure monitors as well. I can send out, a link about what that looks like, but there's a lot of different products out there. And again, this isn't, we can't really say this is what we recommend for your child. You could take all of those different options and bring them to your child's neurologist and discuss with them what they think would be the best option for your child, given their risks, their, nighttime risks. But let me make a note to make sure to send you the seizure monitoring device. All right. Choking and aspiration is a big one. So chewing and swallowing problems occur in more than half of people with Phelan-McDermid syndrome. There's also a European consensus guideline around chewing, swallowing, and gastrointestinal issues. So there's enough of a problem with this topic that there's a whole consensus guideline written about it, which I will send to you. Causes for these chewing and swallowing problems include the low muscle tone, the hypotonia, which is one of, the most common symptoms of Phelan-McDermid syndrome. Dental problems can cause, chewing and swallowing issues. And then the chewing and mouthing behaviors, our children often put things in their mouths, they're sensory seeking, they want to chew on things. So that can cause a higher risk for choking to have stuff in your mouth, right? So the first thing you would want to do is to screen for swallowing issues. Things to look for are coughing and choking during eating and drinking, wet sounding voice after swallowing, which can be harder to realize if your child is nonverbal. recurrent pneumonia. So my son does aspirate. He's been on thickened liquids for years. Every swallow study he has, we know, I mean, the same thing comes up. Um, and honestly, as his parents, I don't feel that he needs a swallow study really anymore because I can tell, if he were to sip some of my water, I can tell it's not going down right. So he's been on like I said, thicket for I think since he was two for a very, very long time. He tolerates it fine. And yet he still has had pneumonia, aspiration pneumonia. He's always at risk for pneumonia. That's one of the reasons we really try to keep him from getting sick as best we can, because if he gets sick, he's at a high risk for pneumonia compared to, a neurotypical peer. Um, Part of screening for swallowing issues might be having a swallow study, which really it's not very invasive. The hardest part for us is getting him to sit still. So they have to sit in a seat that usually has some like seatbelt type straps and eat, basically eat on demand. And then the food or the drink has barium added so you can see it. They x-ray from the side. So they can see the barium coated food going down the esophagus, and they can tell if there's any penetration into um, the the lungs or the breathing canals areas, which I don't know the proper terminology for it, but they're basically looking to see if the liquids and solids from the GI, where that should be in the GI area, are entering into the pulmonary area. Um, so that, if you're worried about aspiration or if you think that might be a concern for your child, you could talk to um, the doctor about how you would go about getting a swallow study. Often it is speech therapists who are present at the swallow study and maybe are the ones making the recommendation to have the swallow study. So they would be someone to talk to as well. Make sure all your family members and caregivers who are alone with your child are trained in CPR and Heimlich. This is like a basic, you know, babysitting training, but it's really important to have that confidence that if something happens, if your child puts something in their mouth and is choking, that there's people present who know how to handle it and are trained to be able um, to properly react quickly. And don't hesitate to call 911. So anytime there's any question of a medical emergency like that, call 911. It's better to be safe and do that than to wait. Um, Talk to your doctor about having a life vac on hand. So that is a device that you can actually helps to suck out if someone is choking on something. So it's something to ask about and see what the doctor thinks if they think that would be a good idea as a product to keep in your home. Okay, so GI problems. GI problems relate back to what we were just talking about because technically, aspiration and choking are related to the GI system. Um, GI function can relate to catatonia and neuropsychiatric issues. Sometimes at the onset of those issues, the individual may stop eating properly. They might seem like they've lost that skill and no longer be able to eat independently. So that, GI problems can sort of snowball into bigger, more serious issues. Constipation is the most common GI problem in Phelan-McDermid syndrome. Um, and that can escalate as well. If they become severely constipated, there's a whole lot of other medical issues that can snowball from that. So you're, working to ensure daily bowel movements, talking to your child's doctor about the types of, should you be using stool softeners or stimulants in terms of helping with your child being able to go to the bathroom. And hydration, again, this is why hydration is so important because it does play into keeping your child's motility or keeping your child um, having bowel movements regularly, right? Sometimes, pelvic floor physical therapy can be helpful for persistent issues with constipation. This would be where you'd want to talk to a GI doctor or a motility specialist is a great type of subspecialty of GI that can be very helpful. We see a motility specialist. We usually see them virtually, but how doctors like to see you in person every once in a while, which is good, but also can be um, more of a hassle. But we do travel an hour and a half periodically to see the motility specialist in person. Um, so that is a helpful type of subspecialty to see if your child is having GI issues. Um, if they're having vomiting and reflux, that can be related to the vagus nerve function. So that's something you could bring up with the doctor and ask about and talk to them about um, if that could be playing into the issues that your child is having. So, and for toileting, if your child is using the toilet and is doing that successfully, then you're going to want to be very positive with that and try to really support them in continuing to be able to use the toilet. If you are stumped, so if your child is going through a period of, you know, medical issues happening that nobody knows what's going on, the doctors are confused and aren't sure what to do, you're frustrated and don't know where to turn, please reach out to us. So you can email me, carla@pmsf.org. You can email info@pmsf.org. That goes to me as well. Um, because we may be able to help. We may be able, if it's a very unusual issue and severe, we may be able to ask our medical advisory committee, is there anything that that they think about or that they would suggest the doctors consider. Um, we may have the right resources and guidelines to be able to help you. So don't hesitate to reach out. That's what we're here for, is to help our families with that piece of clinical care. Sometimes there's underlying infections that you wouldn't know about in our population with Phelan-McDermid syndrome, the same way you might know if your child was verbal and could tell you, my throat hurts or it hurts when I pee, all of those types of things. So, if you're not sure, consider, do they have a urinary tract infection? Could they have strep? Um, are they constipated? Do they have dental pain? All of those types of things are important to rule out because those types of infections can cause pain and can cause behaviors that might look different in our population than it would look in, like I mentioned, the neurotypical population. Um, for psychiatric issues, we have our neuropsychiatric consultation group, which I can send the link to, but basically that would be an opportunity for your child's doctor to consult with our doctors for free. It's a service that we provide. It's a consult. So the doctors would meet together and hear about the case and be able to discuss and give some guidance to your child's doctor. Again, I will send the link so you have that. These are just some, things to keep in mind. I'm going to send the slides so you'll have this, but things to consider if you don't have some of these items in your home, that they can be helpful in either the, ongoing health or prevention. Things like having a nebulizer, pulse oximeter, suction machine if your child does have, the secretions that you need to suction, or if you're worried about their pulse ox falling at night. All types of different things here. The high frequency chest wall oscillation device, that's if you've seen the vests that vibrate to help the child cough, because our children don't always have the ability to have a productive cough. So that's a device that can actually really help with preventing worsening of some of those upper respiratory infections. So I'll send this list to you so you have it, but just kind of a brainstorm of um, different durable medical equipment that should be able to be covered by insurance, most of this. And then I mentioned the Life Vac, but these are some other products our families love: soft shell helmets, the pulse ox. If you don't get a hospital grade pulse ox through insurance, you can always buy one of the little, the little finger ones on Amazon. Medical alert products, like a medical alert bracelet your child could wear so that they have identified that they have, epilepsy or whatever the case may be that you want to make sure people know about. Um, if you're not sure that you want to go all in on something like a safe sleeper bed, there are things like privacy pop tents that you can buy, on Amazon, that aren't going to keep them, they're not going to hold up to someone trying to get out, but they would give them that kind of feeling of safety and security. So adaptive clothing. Those are just some, again, like a little bit of a brainstorm. So we do have our QR cards that are available on our website to help with, if you're in the hospital and overwhelmed and you don't know how to get all the resources to the doctor, you can just use our QR cards and the doctor can scan the code and pull up all of the resources that I've mentioned today. So I'll send you the links to those. You can print them or you can just save the picture on your phone and hold the phone up for the doctor. But it's a really helpful way to get, the medical advisories, the consensus guidelines, all of that um, into the hands of the doctor who's treating your child, especially if you're in an emergency situation or if they're dealing with psychiatric issues. Okay, and then, looking to the future, um, you always want to try to stay up to date on what's out there in terms of emerging therapies and treatments. So that would be a way, stay in touch with us, read our newsletters. We have our pharmaceutical partners. There's clinical trials happening. So it's really important for our families, whether you're going to participate or not, to know what's happening in the world of science for Phelan-McDermid syndrome. Um, Registries and studies, like research studies, that are not trials, they're just gathering information about your child. Those are really important to participate in because that's the way that we can move science forward is getting more information and learning more about Phelan-McDermid syndrome. So participate in those studies and registries when you're able to. Um, Talk to your doctors, your child's doctors about succession planning, what's going to happen if the doctor retires. Well, what's your next step? Once your child turns 21 or 18 or 22 or whatever the age may be, what's the next step? What's the plan? So those are important conversations to have. You don't want those things to sneak up on you. You want to have a plan and feel like you know what's next. And the same is true for everything involving caregiving, housing, education, estate planning. So, obviously that's a lot to think about, but you want to at least have it in your mind and start to be making plans and think about what would be coming down the pike for your child in terms of those things. Okay, so I hope that, that was a lot of information. I really hope it was helpful to you and you learned something today. Um, I think there's a lot we can do to, do our best to prevent our child from having, some different, prevent them from getting sick and having some of those issues arise. And then there's things we have to do once they do arise. There's ways we can handle it and we can be ready with information and with the right specialists and connections. So please, don't be a stranger if you have questions. If you have an unusual medical situation that comes up, please reach out and we will do our best to support you. We are here for you, and I hope that you all have a great day. Thanks again for joining.